and welcome to another episode of Our Point of View Talk Show. We are so glad that you are here with us this evening. This evening, we are going to be talking about the coronavirus. We're going to have an update on the coronavirus. So we have with us this evening, Dr. Kay Stevens from Atlanta, Georgia. How are you, Dr. Kay?
I am well. How are you?
Oh, great. Thank you. Thank you so much for joining us. And all the way from Washington, D.C., we have Nurse Meedy Bartonelli. Hi, Meedy. How are you?
Hey, beautiful ladies. Thanks for having me tonight. And Jacqueline, and glad to see you, Dr. Kay.
It's good to see you again. It's been a while.
Yes.
So let's start by getting an update. Dr. Kay, can you give us an update on what's going on with the coronavirus, please?
Yes, I can. So we know that we are on the back end of the Omicron surge, which is a good thing. However, hospitalizations are still high. So I just want to say that a lot of states have started easing up their mask mandates, and some states are even starting to, work towards what they call an endemic for COVID. And but this is a global pandemic. We're not really there yet. What we are really starting to see is like deaths are increasing, which you will see because deaths tend to lag the infections. People are saying that the case rate is lower or going down, which is true to a degree, but we do know that many of the states we had like the free home testing kits, and a lot of people moved to at-home testing as a means to track their COVID infections, and they aren't reporting it. So whereas we're seeing a decline in cases, that may necessarily be a true picture because a lot of people are testing at home, or they're just going by their symptoms, and they aren't. We are seeing a decline in reporting. So those are just some things to keep in mind. We can kind of talk about later what the CDC is doing. And so, Meedy, what are you saying? Like, what are you experiencing right now?
So thank you so much, Dr. Kay, and pretty much very much so in alignment with what you spoke of. So here in the DMV area, the cases, and I preface that with DC is a fairly well vaccinated liberal city, because I don't think it's you can talk about the coronavirus and not talk about the variations of the political climate that we're in. And so we are nearing at 80%, which is, folks like you, Dr. Kay, will say, okay, good numbers. We're kind of at herd immunity at that point. And that's obviously understanding that young kids had not yet been able to get fully vaccinated. So DC has for quite some time has been in the low to mid 70th percentage of individuals getting vaccinated. The issue now, Dr. K, that we're seeing, I can just tell you from an acute care perspective, and Jacqueline, I always say this, if you know me, I'm not speaking on behalf of the facility or organization upon which I work, but what I will say is right before Christmas and probably towards the end of January, up until about 2 weeks ago, the Omicron virus was so horrendous. Hospitalizations were up. And staff members were then contracting the virus. And most of you are aware that hospital employees were mandated to have the vaccine since sometime last year. And so we saw an uptick because everyone had not yet gotten their booster shot, and booster shots had not yet been mandated, which now here, I also share, not as a spokesperson tonight, but I also have another hat as chair of the DC Board of Nursing. And DC Health has now just indicated that it's mandating all healthcare employees. Again, healthcare employees, not the general public, but healthcare employees should be boosted by March 1st. And so today is the 16th. And so people have a little less than 2 weeks to go ahead and get their booster shots done here in the DC area specifically. So the numbers are definitely a lot lower. We definitely are seeing a downtrend. Deaths have not necessarily, as you indicated, deaths do kind of obviously for obvious reasons lag behind, but deaths have not, so we have not seen an uptick. And there's now a little kind of political buzz in the DC area because their mayor is considering lifting the mask mandate inside certain restaurants now. So as we did last time, we will wait with bated breath to see if Omicron becomes Omega or Alpha, Beta, Gamma, Delta, Epsilon, Zeta, Eta, Theta. I know I'm in a Greek organization, so I know the Greek alphabet. So I'm just waiting to see which one of the alphabets that we are going to become next, because we did have the other Delta variant, and so then we got to Omicron, and so we'll have to wait to see. And honestly, Dr. K, I think at this point there is definitely a lot of COVID fatigue. This is now entering year 3. I met Jacqueline. I can't believe it's been 3 years, and you as well. It's literally 3 years. And I think now we, and I say this cautiously for those that are watching. I definitely think that we're on the other end of the bell curve of the pandemic for sure. I know the pandemic is definitely not over, but I definitely do think that we are on the downward trend. For those of you that remember statistics, I definitely think that we're on the downward trend. However, in my closing opening remark, as Dr. K said, this is not just something affecting the US. Hey, Captain Jackson, but this is also something impacting the world. This is a worldwide pandemic. And so we'll have to see what other countries are doing and how it will then impact us, because people are still traveling. So we shall see.
Okay. Welcome, Captain. How are you? Well, we're glad you're with us. We're glad you're with us. Let's see. The vaccinations. Are people getting them the way they're supposed to? Are they actually getting them? Are there more numbers of people who are getting, who are fully vaccinated?
So what I would say, what I'm seeing here, Jacqueline, honestly, I was on a DC health call. Again, I'm not here as an agent of that, but just sharing the information because it's public knowledge. And I would love to hear Dr. K's take on this. The issue that we have now are the 18 to 25-year-old population. And so if you look at any statistics that, and you can go, at least here in DC, you can go to coronavirus.dc.gov. So this is all public knowledge. And when you look at the number of the age range of individuals, so people that are older definitely have higher vaccination rates. I'm proud to say I'm a middle-aged Gen X person. And so, late 30s, 40s, early 50s, we are vaccinated for, over 50% of us. When you start looking into that new millennial group of, 18 to 20, some early 20-year-olds, that is where they're still a little challenging. And then that's where those numbers are significantly decreased. And so, I think that speaks to trust. I think you've heard me say this multiple times, Jacqueline, that public health moves at the speed of trust. If I don't trust Dr. K to hear what she says, if she doesn't look like me or have the same beliefs as me, then I'm probably not going to go the way, that she's articulating it. And then when you remember the original outbreak of this pandemic and the political landscape that was highly polarized at the beginning. And then quite frankly, young folks, millennials, they get their news from Yahoo and Facebook and IG and TikTok and everything else. And so I don't believe they're the ones necessarily, not all, but necessarily are the ones sitting in front of CNN listening to Dr. Fauci or Dr. Kenyatta Stevens, who has years of expertise and spent thousands of dollars in education to be able to articulate that. So that 18 to 24, 25-year-old group is significantly lagging behind.
Yes, Smeety. So that's pretty much the trend across the nation. And just to throw out some stats for Georgia, we are very much lagging in vaccinations. Georgia is right now at maybe 55% that are fully vaccinated. And our booster shot averages are even lower. So I think if I remember correctly, and I was trying to pull it up on our state website right quick, only about 30, maybe 38%, and that was like maybe I think a meeting I was in maybe a couple of weeks ago, of eligible Georgians have been boosted as well. And so, and the numbers is for that 18 to 35 age group as far as being vaccinated or even being boosted, it has not really moved.
Mm.
So, I mean, they're pretty stagnant.
Now, are the booster shots actually working? Because we're hearing that a lot of people who are actually having to go to the hospital are fully vaccinated and have their booster shots, and they're the ones having serious problems. I know it's probably because of underlying problem, but they're the ones that are having issues at the hospital. So are these booster shots actually working? Because now people are afraid to get booster shots, and it's like, how many do we have to get? Do we have to get them every 6 months, or are they working? Is it the same medicine that we've been taking, from the first two vaccinations?
So I'm going to hop in really quick from a clinician perspective and have Dr. K from a scientific, well, it's all science, but you know what I mean, scientific epidemiologist perspective. The short answer is yes. The booster shots are no different than the initial part of the vaccine. It is not a cure. I repeat, the vaccinations, the booster shots are not a cure. It is not an antidote or any of that for COVID-19. It reduces your symptoms, and it hopefully does reduce your hospitalizations. And there obviously is a significant decrease number in amount of deaths. However, what I would say is that, and Dr. K, I'm sure will speak to this professionally from scientifically, is that every time something happens, viruses replicate, right? And so by the time that Omicron was detected, that meant that Omicron had already been going around before people like Dr. K can actually give it a name. And so just like right now, that's why we're waiting again. Bated breath. This is the same place. We are at the same place where we were probably Dr. K, September of October, and everything was okay. Kids were starting to go back to school. We feel a little bit better. And then boom, this 1 or 2 cases of Omicron. And then, as you all know, I can speak to specifically December through January was horrific in the hospital setting, yet again, because of this, the 5th or 6th surge that we've had. So again, folks, the vaccine is not a curative. No one ever said that it was, and it does reduce the amount of deaths. Now, to your point, Jacqueline, regarding hospitalizations, yes, hospitalizations did increase, but as Dr. K said, before, we'll wait to see about the number of deaths, but there's also those folks probably more than likely had a lot of comorbidities. And there were some breakthrough cases, but we still have not quite understood were all those people boosted or not. Even in my own facility, we did not capture all of that data until midway in this last surge, because I asked the same question. Of the people that are being hospitalized, are we tracking COVID vaccinations, yes or no? So, and at that point, all we could go through is, Captain Jackson's word, if he said he was or was not. We weren't asking people, because, if you're coming to the hospital through the ER or whatever, we're not asking you to pull out a vaccination card. And so that data point is very sketchy.
Okay. Okay.
And so, just to reiterate some of what Meaty said, yeah, boosters did work. But the pharmaceutical companies are reporting that they last about 10 weeks. So
The booster lasts 10 weeks, or the vaccination?
the booster.
So every 10 weeks, you're going to have to get another booster?
No, they're not saying every 10 weeks you'll need to be boosted, but for the purposes of Omicron and for like that surge, so a booster, that's what the purpose of the booster is, to give you like that jump. It's like almost like it's like jump starting your immune system, so to speak. So it made your immune system like hyper aware of any of the virus. And that's how it worked. So yes, it worked against Omicron because it's like you you got boosted. So you had that extra dose of the vaccine. So, but now they're saying that the booster is wanting. So just as the same reason why they came out with boosters, they do know, and they do have evidence now that shows that the vaccines do diminish in efficacy over time. So that's why there's a booster. But do you have to get a booster, a fourth booster every 10 months? No, you don't. So they are working on improving the current vaccines. So if Omicron didn't teach us anything else, it's like you always have to be prepared because you don't know. And I think people kind of had that false sense of security since we had Delta and things just kind of got better and people were outside, and then Omicron hit. So not saying that they're not saying that every 10 weeks you need a booster, because that's not the case. However, if there is another Omicron variant or another, whatever the Greek name is, then they may recommend another booster, especially for those who are immunocompromised. And so it just depends. So we just have to be aware, but they still, I mean, things like mask wearing and all of that, it's still important. And I know so many people are ready to ditch their mask, but and there was like the whole thing saying that, you know, the cloth mask really didn't protect you against Omicron and that you had to have a KN95 and better, because that's what they saw was like more effective. So there is a point to mask wearing. It all works together. And we've talked about this before. You can't just rely on a vaccine. You can't just rely on a booster. Those things are important, especially if you have underlying conditions or if you're immunocompromised. But you still have to continue to do those other preventative measures. And I think that's where a lot of people kind of went wrong, if you will. Like they didn't wear a mask. They're like in crowded places. They weren't social distancing. And I know people who still tested positive with their quote unquote at home kids, and they still went out. And then we got some mixed messaging. And so people just did whatever. So when I look at the numbers and like when you just really talk to people and it's like, yeah, I tested positive, but it's been 5 days and I only have sniffles or whatever. And I'm like, well, you're still symptomatic. So why are you out? So it's just, there are a lot of things that kind of contributed to that. But for the most part, when we looked at the hospitalization numbers, those who were hospitalized with and were boosted or vaccinated, most of them were in the hospital for another reason, and then they just so happened to test positive for COVID. It's not like COVID, they had, you know, all of these things, and then, you know, COVID put them in the hospital. So I think a lot of that was not really shared properly. It was just which came first, the chicken or the egg kind of thing. And so they were in the hospital for a different reason, and they just, you know, they test the patients, and so it was just that. So then, you know, everybody was like, oh, I was vaccinated and boosted and they were still in the hospital, but COVID is not what put them in the hospital. So I think we should just kind of make those delineations there too. So yeah.
Hey, Dr. K, so I have a question for both you and Meady. You may not know, but I'm still here in California and I have been for 3 weeks. Most recently, and I apologize for the background noise, but most recently the governor, actually today was the first day where they were not enforcing the mask mandate outdoors. For outdoor events, the mask mandate, back cards, and well, those two mainly. And they're inching closer to applying those to the indoors, specifically like indoor restaurants and stuff like that. So these businesses can open up. Now, of course, you probably already saw today that there was a huge victory parade for the Rams. And I was sitting back, me and my mom were sitting back looking at this parade and all these people that in unorthodox parade fashion, as the float passed or as the vehicles passed with the football players, the folks actually followed the buses down to the venue where they were on stage. So all of that was moving. in small groups all together. So my question is, with those types of things on the horizon, how how is this going to look moving forward? I realize California is in a bubble. However, there are folks that came from all over the world to see this game and that were in the stadium that was full to capacity. How do you see things faring out going forward with respect to um, COVID procedures, wearing masks, physical distancing, and just a lot of the mandates and standards that they put in place to help keep people safe?
Yeah, so outdoors, really, well, I will say this. Typically, um, if you're vaccinated and boosted and all of those good things, outdoors isn't really a risk, a high risk. However, when you're static and like you're just in a like one spot and you're not masked and you're in a group, then that's when the risk tends to happen. So like when you were saying like you had these fans and they're following this bus and they're grouped together and it's not like, there's like the proper airflow or whatever as we would expect outside. So like they're saying you can run outside and be fine. If you're in a stadium and you're seated around other people and you're just sitting there and there's, you're not, that's where the challenge comes. So it's recommended that you wear a mask. So when you have these people that have come from all over with different, requirements as far as like vaccine status, it's a risk because you don't know whenever you're out with outside unmasked, static, with people you don't know. So I know, well, I won't say I know people, but there were instances where we know people that got on flights that had tested positive for COVID. They just didn't care. So it all boils down, and we've talked about this, before on this show, to personal responsibility. It has to be behavior modifications. Like, do you care about the next person? Because I'm pretty sure there were a lot of people who were still COVID positive that was like, this is a once in a lifetime opportunity and I'm going to go. I don't care.
Right.
So I suspect that there will be like a surge in cases after this. It happens. That's what happens. We've seen it on a national scale with other events. And it's just, like Meaty said, like we're all just kind of fatigued because people just have no regard for other people. I mean, they are positive. And then I'm like, if you like choose a circle, if you're gonna be positive and you want to go out and do things, at least wear a mask. At least, do that. And they're not even doing that. And so it's a challenge right now. It's
Dr. K, that part about the personal responsibility is a significant issue. I've been around folks, I had a program that I went to this weekend, but these are people that I know are vaccinated, that we know that are boosted, et cetera. I think for me, it's different when you're going to an environment where it's completely, the folks are unknown. I just had a conversation with a fellow mother, and we had a conversation about parents knowing that their kids had maybe tested positive at home with their rapid test. So instead of getting the PCR test, they just went ahead and said, well, I'm sending my kid to school anyway, and just don't say anything. And so those are the scenarios when you can't necessarily rely upon everyone else. I know for my son's school, for example, and I'm happy about this, is they do get tested, and like every 2 or 3 weeks, they actually test all, I think 600 or 700 of the kids. Like they all have to get tested, including, faculty and staff, where you have to come in on a Sunday and Saturday and, based off of your alphabet. And so those are the type of things where you talk about public assurances and, the public health and awareness and personal responsibility responsibilities for people. And that other scenario I talked to you about, and I'll just be honest, it is of a different political persuasion. And so sometimes, people are getting into this, oh, it's my personal liberty, it's my personal right, which is true, but so are when people used to have to wear seatbelts, right? Seatbelts were not mandated until enough people started dying from wearing seatbelts. Women used to smoke all the time while they were pregnant until they said, no, you shouldn't do that. And here is a big notice on the back of the box that you should not do so. It's still your personal choice. And so that's the part where when you are going around and about doing your own behavior, you have to make sure you are modifying accordingly. My husband and I went to an NBA game here at the MCI Center, Dr. K, and had N95 on. We were like, nope, we're not getting any snacks. We're not getting any sodas or nothing. And, we actually, we watched a game. So it was like an hour and a half. NBA games no games are really that long, so it's about an hour and a half. And then we left and chose to get food once we left on our way home, instead of having to take our masks off while we're there. So I think there's ways where you can still be very judicious and very cautious in your round and your coming and goings. But as we continue to move forward, I think we're going to be kind of teetering this tightrope and doing this walk as this process continues.
So now with the different events that are going on, are they going to just start doing away with the protocols so that they can have like the indoor events, so that they can have the customers come to their events so they can start back to, making money? Are they going to just do away with the protocols?
Honestly, most of them already have. They're not enforcing it. They're not checking anything. I mean, I went to an event here last month in Georgia, and it was like considered a political event, and the governor was like, you can't enforce people to be vaccinated, and you can't enforce them to wear a mask.
So what about the companies, the businesses? Are they still enforcing their protocol? Are they still terminating employees who do not get vaccinated? Or have they just started?
I don't think that's
hiring back?
happening as much, Jacqueline, because they don't want to risk any civil suits, I think. And it is hard if the jurisdiction or the public health department in that area is not mandating it. I don't think they would have a leg to stand on. Now, in the school system, again, the private school systems, because they're private, they can choose to do what, they can make up whatever rule they want to, which is same thing with kids needing to go and, say go to mass or whatever else if you're in a parochial school. The other, but the public schools, they can't. And I would say the other issue that gives a lot of cause to pause. I don't know if you all saw, I was trying to pull it up. There was a nurse, Dr. Ken, I don't know if you saw, I'll text it to you all after we get off this live, had basically received $1.5 million in selling fake vaccinations.
Oh my.
Fake vaccination cards. And so they would allow people to come and pay and get that card because, for me, and I don't know how you feel about this, Dr. K, but that's me showing a card. Anybody can really get a card. So for me, honestly, is that at this point, it's really up to you to be careful and cautious because anybody can get a card.
Yeah.
And
anybody can get, and I'm telling you all, as Meady Barnelli, a registered nurse in Washington, D.C., I can easily get my hand on a stack full of cards.
Mm-hmm.
If that was something I was going to do. And I have not. I repeat, I have not. I will not.
And she wasn't talking about herself, people. She was saying it is.
I'm saying it's the access, the ability to get that is easy. It would have been easy for me to do so. So when you see these type of things and they're also in the news, again, you just have to be careful. And there's no hard rule about this, unfortunately.
Yeah, because they're not, you can have anybody's vaccination card. I went somewhere and they were like, okay, show your vaccination card, and you show it and they're not asking me for my ID.
Mm-hmm.
I could have had anybody's card.
Right.
So again, it goes back to, and like Meady said, you have to know who's in your circle. So I know I'm going to move a certain way with people who I know and that I can trust. Because we tried like the pods or whatever at the beginning of the pandemic, and that didn't work because people had multiple multiple pods and all that kind of stuff. So you just really have to have those honest conversations and like, hey, what else are you doing? Are you going somewhere? You know, like, are you hanging out with people? Because I have friends that are like, hey, let's hang out, let's go. I haven't seen you in forever. And I'm like, but you here, there, and everywhere. You're in the club, you're I'm like, I can't. I just I don't care. Vaccinated, boosted, whatever, like it's still a risk. And I'm risk averse at this point. So you really have to know the people that you're around at this point. And a lot of states are moving to operating as if, COVID now is endemic. Um, and and again, we're not there yet because
And
we
Dr.
don't.
K, I'm sorry to interrupt you. Can you share that for the listening viewers? Because I get that question often, and I would love to hear your definition. People are like, well, what's the difference of a pandemic and an endemic? Like, what's the difference?
So pandemic is a disease that's a pandemic. It affects it's global. It's a global disease. Endemic is when you live with it within like your area. So flu is endemic. Flu is an endemic disease. So, but not every state will have like a high flu. Like we have a flu season, but there are some states that will actually have like an outbreak of flu. Like classrooms can still be shut down for flu. So, just depending on like the number of kids, as Meady said, people will send their positive kids or their sick kids to school. Like one of my nieces, she had already gotten COVID from someone at school. And so luckily, she was okay. And then a month later, she was sick again. And so she's like, oh, please don't let it be COVID. And it was the flu. She was more excited about having the flu than, than having COVID. But guess what? She had to stay home longer with the flu than she did with COVID. So which confused her even more because she was like, well, if I didn't have symptoms, I could go back to school, after this amount of time. But with the flu, they're basically mandated to stay out like, X number of days and like that. So it's so much that goes into that in certain states. So it's crazy because not every state is moving to an endemic type phase or, transitioning out of this pandemic. The World Health Organization would have to declare COVID as an endemic disease because again, it's everywhere. It would literally only take a couple of people to travel to a country that has another variant to bring it back to wherever we are.
Hey,
What
Dr.
happened
K.
when we got Delta?
Yeah.
Hey, Dr. K. So, and not to go too deep into it, but I think about a few years ago, back when the whole Ebola thing was going on. I know we had flown a couple, and I think you may have been on the front lines or dealing with that really closely when we were flying folks on these private jets, a motorcade on the freeway, getting them to Emory. What was this is gonna sound crazy, but just for our audience's purposes, what was the sense of urgency with that, and how does that differ from what we're going through now?
Oh my goodness. The urgency was like, what's the highest? I always joke DEFCON Alpha, because there were only, I want to say 10 to 15 beds in the US that were high containment suites for people with Ebola. There is no way our infrastructure at that time was not built for Ebola, period. So that's why it was like, okay, we need to contain these people that we have brought over from I think it was Guinea, and because Emory had those beds. So take them to Emory. But if anybody else had gotten Ebola outside of those people, and it was like an outbreak like we were seeing like in those African countries, it would have been devastating. So the level of care that happened with Ebola was escalated much more than we're seeing with COVID, and COVID is definitely more contagious.
And I think too, Dr. K, to your point, I remember I was working in a hospital too, Captain Jackson, during that time. And, varying diseases have way more, they attack your body completely different. Even when I got COVID, for all intents and purposes, I did okay comparative, but Ebola was one of those things where I don't care, you could have been the healthiest of the healthiest person, and it was going to be a struggle. Whereas coronavirus, very highly contagious as well, but the impact, I think it was a lot longer. Now, clearly, as we know, and God bless, over 700,000 plus individuals have lost their lives, but a lot of those folks, again, comorbidities, et cetera, people not aware that they had it, et cetera. But with Ebola, it was one of those things. I remember, Dr. K, of people happen to get their blood drawn, and they didn't even do the blood testing in the hospital. They would literally courier it to the CDC here in Bethesda, Maryland, to make sure those samples were handled appropriately. So, again, I think the message on Jacqueline for me continually, every time you allow Dr. K and I to share, is this how important it is for you to be health informed and be health empowered, and how important it is for you to really value this vessel that you've been given to do whatever your work is, whether it's, producing radio shows and producing content, or whether it's, saving lives from people from burning buildings and helping to mitigate, fire hazards, et cetera, and saving people's lives in that way, or me, saving lives in a hospital setting, or Dr. K saving lives or having intention by, studying disease processes and viruses, et cetera. So I think we need to ensure that we always remember that health really matters, and health is so important, and that you all are really only accountable for yourself, unless you have like a little kid or a baby, to really make sure that you are caring for yourself, that you're getting those checkups, that you are seeing the right people, that you're getting health information from correct, adequate sources. If Dr. K she could be a doctor in music theory. Well, I don't want to talk to her about the coronavirus. So what is that PhD in? Her PhD is not music theory. Her PhD is in epidemiology. She's a scientist. Or her PhD could be in human behavior, which is great, but I need somebody to study this virus in this little container, petri dish, right? And so know where you're getting your information from, and know those trusted resources. I wouldn't just give, no offense, Captain Jackson, if I hit $1 million, I'm not going to just give my money to Captain Jackson. I'm going to go find a person who's a CPA, or find a person who's a financial planner, and that's their background, to help me to do that. So I just think all these conversations, what I've really learned over the past 3 years is how important it is now. And I said this, Jacqueline, and you remember Dr. K early on, what I want to do is figure out 5 years from now, what's going to be the impact of my health because I had COVID 5 years from now. That's what I want to know. I want Dr. K to be able to draw my blood, and in 5 years say, okay, you have no residual impact. And that's the other piece, Jacqueline. There are still COVID long haul people out here that are still dealing with things. As I've shared, like with my blood pressure stuff now, thank God, under control. But I'm just saying, there's still those issues that are out there. And then the second piece is our healthcare, sick care system. And what is this going to look like? Because we are literally teetering on the brink of a massive financial disaster in our country because of how much money and resources have been allocated to this health pandemic. And our national budget was already a thing of concern, right? Can you imagine all the millions and millions of dollars, nurses leaving the profession? Are we going to have enough staff in the hospitals to care for the other regular sick people with other diseases other than COVID? That's where my energy is now being turned towards.
Yeah, and that's true. Edie, you brought up a good point, because research now is showing that COVID basically accelerates any future disease. Like if you were predisposed, or like how they say you have pre-diabetes, and you have you're like on the brink of cholesterol, or you have a heart attack. So people they're seeing that people who would not have developed diabetes until like a 38-year-old, because we're seeing a lot of this in that 30 to
Or me with the family history of hypertension, but I didn't have it, but now I had it. Yeah.
yeah, because I mean, they don't know if it's like a genetic thing, like if COVID is affecting like, your genes as far as like that type of disease. Not is changing your genes, people, nothing like that. But because I have to put that disclaimer in there, but that 30 is like 30 to 39 and maybe up to 43. They have diseases that have been accelerated. So whereas they may not have had developed diabetes until maybe their 50s, they're seeing it now in their 30s because COVID has accelerated that disease development. And it's so, I mean, it's intriguing, but it's sad. Like to me as a scientist, like, oh my God, like even with like high blood pressure, the heart attacks, a lot of the things that we're seeing in young people that typically they would not have had, started to have issues
They got older.
until they were older.
Yeah.
COVID accelerated it. So that's why it's so important to go get your checkups. It's so important to like, work on your body, work on your health. And, because COVID is still there, even for those of us who haven't had COVID yet, if it does become endemic at some point, they're saying everybody will have it. It's a cold, it's a coronavirus. It's a part of the cold family. So, and now we're seeing studies that said that's showing that some people who thought that they just had a cold because their symptoms were mild actually had COVID, because, coronavirus, it's just what we're going to see.
And I think so what do you say to the folks that with what you mentioned for Meaty, if I'm correct, and please correct me if I'm wrong, you said you're, I guess on the 5-year stretch, you're wanting to see what were the effects of COVID relative to your health and so forth and so on. Do you feel those same concerns are shared by people who had that feeling regarding the vaccine? They're wanting to see, hey, 3, 4.
No, hey, listen, Dr. K and I think when we first came on, and we were on this with Jacqueline, again, thank you, Jacqueline, before the vaccine was developed, or released rather. I know they were probably working on something immediately when COVID happened, but when it was able to be released, both of us were hesitant. I have no problem saying that. I was very hesitant until I then paused and did the research and read and understood. Again, and Dr. K is way more versed in this. They don't just make stuff overnight. Like when she was in school, you create studies and you're doing things. Now you just kind of accelerate it. And by the acceleration, it means you don't have to go through this long IRB process and all the red tape that it takes to do healthcare studies. So you mitigate and not do those things that happened back with Tuskegee, right? And so, yes, I do want to know, like, what's going to happen. Do we have to get these shots every 90 days, as Dr. K was saying, or I'm not sure if you said 90, I apologize, Dr. K, but every couple of months, are we going to have to get booster shots and stuff? No one. I am a nurse. I am a healthcare professional. I do not purport, or is that, medication is not my first line of anything. And I have no problem reiterating that. Now, I do think there's certain things like, yes, there's common sense. And if there's a remedy, let's do it. But most things, our bodies are made and created scientifically, are a huge, one large, dynamic, that's what's the word I'm looking for. I had a complete total brain lapse. Our body always does its best to counteract things that are happening. Our bodies are always in a constant state. It's always very dynamic. And so like right now, all of us, our body is fighting off some infection. We came in contact with some infectious something today, but because we have white blood cells, our body is able to fight that off. And so we're not sick. We have no idea nothing is going on, right? And so for me, Kathy Jackson, I think, again, it goes to where is the narrative, who is speaking. Right now, I think we're just dealing with the immediacy of things. I think we're dealing with the economics of things, which is why businesses want to stay open here. And I'm in Washington, D.C., the nation's capital. even when we had the housing boom or housing issue, DC never really lost a step. Dr. K, was still in the DC area back then. They were still building, people were still moving, apartment buildings were still coming up. I'm like, well, I don't know where this depression is or this recession is happening in the rest of the world, but in DC, I did not see that. But what I have seen during this pandemic, three of a couple of favorite spots that I used to go to, like smaller business, not chain restaurants, have closed. I'm not talking about like the big cheesecake factories and stuff like that, but I'm talking about smaller, the Jackson Diner or, whatever it is. All of those places, 3 places that I know that are right down Dr. K on 14th Street, which is a very heavily populated city, part of the city, closed because they were not able to sustain their businesses, particularly restaurants,
Mom and pop
and
places.
eateries.
Yeah.
And so I think that's why I think it's a political push to take these masks off and let people just live their lives and then let the cards fall where they may. Therefore, you and I need to adjust accordingly for
Right.
what your comorbidities are and your vaccination status is.
Right.
Yeah, I know we only have about 10 minutes or so left, but I want to see, can I ask a question about the coronavirus and the effect that it has on pregnant women? Can we talk a little bit about that if you guys, can give us a little information about it?
Yeah, so what the research is saying is that pregnant women who are not vaccinated are having worse outcomes. So COVID will can cause fetal death and again, like we talked about, like some of the disease preeclampsia, some of those things that a lot of pregnant women face. Those are some of the effects that COVID is having on pregnant women. But what they're seeing is that pregnant women who are vaccinated are not having those issues. Because there was like this whole thing where a lot, and that's one of the things that we're definitely trying to bring awareness to here in the state of Georgia, because we're seeing that unvaccinated pregnant women are having poor outcomes than vaccinated pregnant women. And so just kind of trying to bring light, because there's this thing, social media, wherever, the vaccine will affect your fetus, and that's not true.
Okay. Now, what about women who are trying to get pregnant and
Women,
they've had COVID? Will that affect their reproductive organs at all or anything?
so
Issues?
they aren't seeing, so what they are saying is that COVID is affecting like cycles, menstrual cycles, but still don't have enough data on like women who want to get pregnant, like that age group or whatever. I think it's like, it was 18 to 46 or something like that in that group. So we still, again, vaccines haven't even been out a year yet. So when we think about it, because it's good, it seems so long. Like, I feel like I've been in this forever, I'm not gonna lie.
Same here. Same here.
So still looking at, because they have to have like a comparison group. So again, vaccines, have been out, so they have to have enough time for people to volunteer and be in these studies to have the comparison group to say, what the differences are. So
Now they're not doing studies on pregnant women, right? Like with the studies for the coronavirus, there's certain groups. They're not doing it with pregnant women, are they?
they are
are? Okay.
some research. Yeah. Mhm.
Okay.
And don't forget too, even the control group that they did and the variable groups back then, people, it wasn't as though they weren't having sex. So even in the middle of, doesn't mean that they were saying, okay, you have to be celibate for 5 or 10 years. So what happens if people then get pregnant or find out that they're pregnant when things are happening? And so again, it goes back to, my same statement a few moments ago that Captain Jackson responded to is, we're not going to know. We were changing the tire in a moving car. Now we had a couple of flat tires with these spikes and surges. And now finally we get the car to where it needs to be. And so we're going to have to unload it and see what is it really carrying and what is the impact of it. No different with anything, you assess, you make a diagnosis, then you treat and you create an intervention, and then you reassess again. And so I think we're going to be in this reassessment phase for quite some time. I mean, even going all the way back to 1918 with the flu pandemic that we had experienced, none of us were alive then. Well, it took years for them to understand what it is. And now it's just, people still die from it. And I think we talked about that early on as well. And so I think COVID will just kind of be, oh yeah, you got COVID, oh yeah, you got the flu, and correct me if I'm wrong, Dr. K, they're all kind of still in that SARS family, which is the same thing as a common cold. So it's just kind of, okay, do you have the flu, or do you have a cold? Do you have a flu, or do you have COVID? And I think that's where we're going to be in a couple of years from now. No different when, Dr. K, when you go to the hospital, they did a rapid strep test. Oh no, I have strep. It's all in that same strain of viruses, a family of viruses. And so I think that's my projection and prediction, is that we will be in that type of thing where a couple of years from now, you kind of got a cold symptoms, they'll do a swab. Oh no, you don't have a rapid strep, you have COVID. Oh, okay. And then you just will stay home and do it. And because you should stay home when you have the flu, but people don't always do that.
Right.
Quick sidebar, people still should stay home when you have the flu, but they don't always do that. And
And
that's how the
cold.
flu continues to get contagious.
I don't want your cold either.
Right.
Yeah. Now, why did they, or have they cut down the quarantine time? Is it no longer like
They did. It was initially 14 days and it was 10 days and now it's 5 days. And I too believe that is an economic push, because employers are going to either have to have liberal pay or people will be out of work and you're going to lose manpower. That's my personal opinion. From a leader in a hospital clinical setting, Dr. K, I don't know the scientific rationale behind that, because typically, you really want to make sure you're asymptomatic and not have all these issues. But for me, I think they released it because they feel as though it was definitely impacting the workforce.
It was a push a lot, mostly from what I've read from airlines and big businesses, corporations, because they were like, we are having to cancel flights because people are calling in. And so it's no secret, I think it was American Airlines or somewhere petitioned CDC to shorten the time. And what I do know as an infectious disease epidemiologist, if you are still testing positive, then that means you still have active infection. I don't care if it's 5 days, 6 days, 1 day, 2 days, 3 days. A positive test means active infection, and you can still infect other people.
And that's up for how many days? How many days are you actually contagious?
It with COVID, it just depends. Like you literally should, and Omicron was like the outlier for all of the variants that we've seen previously, because Omicron didn't get deep into your lungs. It was more transmissible because it just kind of stayed in your respiratory tract. And so with that, you didn't have like a high enough viral load to detect immediately. So it took about 3 days. So people, felt that scratchy throat, and they didn't realize that the scratchy throat was a symptom, because again, didn't see that with other variants. So they still went out. They were positive, they were transmitting it to other people. And so they were like, oh, well, I took a home test and I was negative. So what we saw, that you could test negative in the morning, by that afternoon or evening, you were positive because it replicated. You had a high enough viral load to be detected. And that's just how stealthy that the Omicron variant was. So people were testing positive anywhere from 3 to 10 days. So, and they had symptoms. They didn't realize that night sweats was a symptom of Omicron. And then I had to do like this whole thing, because like, Lord, December, Christmas time, my phone was blowing up, and I'm like, I'm about to put like a pre-recorded message.
Do not disturb.
Because I'm like, are you getting a test? And they were like, and of course people wanted to gather for Christmas and New Year's and stuff like that. And they just kind of threw caution to the wind and was like, hey, we're still gonna go out. So it's really mind blowing. And now, like, to Meaty's point, I get the question, like, where, what's next for us in COVID? And we're still in the early stages of this pandemic when compared to when we look at that, the 1918, was it 19? Yeah. They were in it for almost 4 years. It wasn't just a year. It started that year. And if you do a quick Google, you'll see, like, and
So this is basically our new normal for a while.
it is, but we have to learn how to adapt because there are going to be other things coming.
Oh, absolutely. I mean, think about it, Dr. K. I mean, and we're all in this group old enough to remember when HIV/AIDS was like, oh my God, don't touch people, don't kiss anybody, know your status. Now people are having sex with people who do have HIV, right? And knowingly have it. And so they take the appropriate measures, not purporting that. I'm just simply indicating that time has changed. So when you look, that took a whole decade for us to kind of, and for me, even in the hospital setting, if that person had HIV, we didn't treat them any differently, but we were definitely, doing more PPE than normal, right? And so now it's just kind of, oh, hey, how are you? You can touch them with your hands as long as you're not touching any bodily fluids. You just wash your hands and you move on, right? So I think for me, to Dr. K's point, and that's a really interesting concept that I honestly hadn't thought about, Dr. K, is, yeah, that's why I said, I think scientifically, you think about the bell curve, we're probably right at the bend, but it's still a long way down before we can say we're completely at an endemic, I guess. And we're year 3. And so if we are comparing it to other major health issues and things that we've seen, even HIV, when it started becoming widespread, when we talk about the opioid crisis, which had already been here. And by the time public health got aware of it and we got the information out, then you communicated to the physicians to stop prescribing all these opioids and you talked to the pharmaceutical companies. So just now we're kind of stepping back from that. So to your point, Dr. K, I do think it's just a part of being comfortable, being uncomfortable. And it is the new norm, not even new norm, this is our normal. As we grow and get older with technology, information passes a lot sooner and a lot quicker. I'm hoping, to Dr. K's point, that we will soon see where this does become a part of a normal. I think because a teetering of back and forth of information and mandates are still there. So until we can all take our mask off again and I can wear lipstick, Dr. K.
Yeah, right.
Meaty, let me tell you, they can miss me with all, going back to your point about the whole HIV thing. I'm sorry, Jack. I know it's another show, but all I'm going to say is they can miss me with all these PrEP commercials because they're really promoting that stuff. To your point, Meaty, like, yeah, it's before when HIV came out, it was like, you took the precautions were there. Now it's like a free for all. Hey, go for it. We got some medication that'll help you out.
But okay, so, and just to go there, because that's something that I have been taught, I just don't do COVID. I
right.
do HIV and AIDS as well. And so there's a more deadlier variant or strain of HIV that has been discovered. And it's been circulating for about 10 years. And it actually progresses from HIV to AIDS about twice as quickly, twice as high as the other variants or strains. And to bring it back to COVID, they are thinking that a lot of people with HIV, untreated HIV, they may not know their status, that get COVID, I loosely say this, they have been what is the word? How I want to put this?
Don't say it.
Unfiltered, straight talk, no chaser.
No chaser.
Those are hosts for new COVID variants. So a lot of these diseases are learning from COVID and other viruses because they're all retroviruses. They're RNA viruses.
And they're running these commercials like
And
they're
I'm
Super
like, no.
Bowl. Jackie, take away.
Yeah.
Well, we're gonna have to end right here. Because like you said, Eric, yes, that is a topic for another show. So,
Yes.
Because this
well,
is
we wanna
our point
thank-
of view.
Yes. Our point of view.
Yes,
So,
our
yeah,
point of view.
yeah.
We want to thank you guys so much for being with us again.
Yes,
It's our first update for the year 2022. We really appreciate it because, like we say all the time, our viewers need to know this information.
Yeah.
They need to get it from the professionals, not from each other, because you're passing it back and forth to each other. I mean, it doesn't matter because don't know if it's true or not. But when you have the professionals who are telling you or answering your questions, then that's what we're about. We're about getting the professionals on to give us the correct information. So thank you so much, Dr. K, for being with us. And thank you so much,
Yes,
Edie,
thank you.
for being with us as well. And we thank you so much for your service. We appreciate everything you're doing for the public. Please
we do.
stay safe out there. Please, continue to stay safe and all. And we're going to have you back so you can continue to give us some more updates. But thank you also, Captain Jackson, for joining us all the way from California. We appreciate you so much.
I'm leaving next Monday, so I'll be back.
Okay, so next Wednesday you'll be back live, right?
Yes,
You'll be
yes.
back in Atlanta. Okay,
Yes,
great.
yes.
Well, guys, thank you so much for joining us as well. And remember, everything you heard and everything we said was our point of view. We'll see you next time. Bye-bye.